Welcome housemates and viewers. I'm Alana and I have a plan to defeat the COVID-19 virus. We've been holed up in this place for 2 weeks now and we've had a lot of time to get to know each other, share ideas, and so we came up with this idea together. I'd like to briefly introduce myself to my housemates. This is Julie.
Hello.
Julie's an international student from France. Tell them why you're here today.
So I'm a PhD student in ecology and I came to UC Davis for collaboration on restoration ecology, and I'm here to support Alana and to fight the COVID.
Yes, good job. And this is Marisol. She's a housemate as well.
Hello everyone, my name is Marisol, like Alana said, and I am currently a University of California, Davis research scientist in a neuroscience laboratory, and I'm here today because I would also like to support my housemates in their efforts, and I think Alana has a lot of really good ideas.
Thank you. And then Miguel is on the camera, so we can't capture him right now, but he's been the one that set this whole thing up, and I call him the social technologies engineer. Okay, so just to be clear, the intention of this presentation is to spread the message of hope, courage, action, and resiliency, because I think we can all come together to, regardless of nationality, organizational affiliation, or profit motive, we as a people can come together and fix this problem. And I think we must, because it affects everyone. So that's the goal. I'm going to outline what I see as the 3 biggest challenges of the COVID-19 virus. Okay, so challenge number 1 is that we have limited access to resources. So we have limited test kits, for example, and very importantly, we have limited hospital resources. So ideally, in an ideal world, we could just all rush to the hospital and be like, test us and find out whether we have it or not. We can't do that, there's not enough test kits. And also there's people that are already filling the hospital beds, so if we get sick and rush to the hospital too much, then there's just going to be a widespread, the virus is going to spread faster that way. Okay, challenge number 2, there's an urgency to act swiftly and smart so that we can avoid panic and chaos. Okay, because that's going to only spread the virus more. And challenge number 3 is that we have to learn new ways of collaborating. Our society was not designed for collaboration, so new ways to cooperate instead of to compete. Instead of competing. And luckily, I've been studying cooperation methods for the past 5 years, so this is an opportune thing for me to propose. Okay, so how can we cooperate and collaborate to defeat the COVID virus? Alright, so those are the challenges. I propose the creation of 5 teams. I call them my 5 powerful teams. Got 5 powerful teams. And here they are. The first team is what I'm going to call my data tech team. And later on I'm going to define exactly what each team's roles are going to be and what they're going to do. Data tech team, that's team 1. Then we're going to have the test kit delivery team. Team 2. We're going to have the sanitation. Wait, how do I spell that? Sanitization team. We're going to have the hospital response team. And most importantly, my favorite team of all is Everybody Else. Everyone Else. biggest team. Okay? So, how are these teams going to work together and what are they? Here's my definition of each team. This is so fun. I haven't like done a presentation in a long time. Okay. And if you guys have any questions, just feel free to ask. You can stop me at any time. All right, so team 1, the data tech team. Data tech team. They set us up for success. Basically, the data tech team is going to collect information from the population. So here we got some people, my stick-figured people. In the population, well, most of them are healthy, some of them are sick, some of them have some symptoms, but not all symptoms. Who knows, right? So basically, the data tech team is going to design a data aggregation app where people report their daily symptomology. So I've got a cough, I've got a cold, fever, my body aches, whatever the symptomology is. And I would want to work with an expert in the symptomology, obviously, we'd want to work with that to develop a comprehensive list. Then the data tech team is going to aggregate the data from the people. So we collect the data, and we figure out how to best report and map it. Okay, so I'm thinking this is one way of visualizing the data, but I'm sure the data tech team could come up with an even more sophisticated one. But let's suppose this is a map of the world, and I don't know, I'm just pretending here. So we can have geographically synced information about where the highest concentrated areas of need are, for example, and how it changes over time. So for example, we have a lot that shows up here. That means that once we visualize the data, we can focus our resources in those places better, as the response teams later on will have this information. So who would I need for the data tech team? I need people that can develop stuff for Android, for iOS, and also for websites. So we make it really easy to collect this data. I need a data scientist. I need a web developer. Just whatever Google has. Google, just send us the best of what you've got. That's what we need, basically. My general call to action is, who do you know with these skills? Because there's a lot of people that can do this overnight, probably, if we get the right people together. Okay, so the goal of the data tech team: collect data from the population, aggregate the data, and then create almost real-time reporting about what's going on in the world in terms of the virus and its symptoms as they show up. Okay, what are we going to do with this data? That's what's next. So team number 2.
Alana?
Yeah?
I know on my campus site in France, like they are trying to launch an app. It's like a real-time screening of COVID-19 cases and early detection symptoms.
Yeah.
So it's kind of the same, but they just answered me this morning, like they do it like with blood
with blood droplet?
Yeah, so it's totally another idea, but
yeah,
maybe there's something.
Nice. Great. So this is an example of what I'm looking for. As people watch this video, you're going to have ideas, suggestions, you're going to know people that are already doing things, and we're going to need all that together, right? So Julie already has a connection in France, people that are doing similar things, right? So now we need to connect with them, so she can help me do that. Okay. So thanks for that, Julie. Test. So the next team is the test kit delivery team. Okay. So when we have information about people that have the symptoms, like if they have all 10 symptoms or however number of symptoms, the hospitals are overwhelmed, so we don't necessarily have the right sort of means to deliver test kits. But once we have all the symptomology, then what we can do is create a system to test them. And this is how I conceptualize that. We have test kit manufacturers. So this is whatever that looks like. So the test kit manufacturers, they're producing them as fast as they can, but they still can't produce enough for everyone who might want it. Like, and you can get tested every single day, right? So we can abuse the amount of test kits if we're not too careful. So you have the test kit manufacturers. They're going to, and this is where I think we can have a strategic partnership with a delivery distribution system like Amazon has. So if Amazon's watching this, which if anyone knows, anyone that works at Amazon, please forward this video on to them. Amazon's got a super sophisticated delivery network, and I've worked for Amazon, so I know this firsthand. So Amazon can take the test kit manufacturer's stuff and distribute it throughout all their fulfillment centers so that it's easy to respond to the needs as they arise. So as the information on the from the data tech response team shows up, you might need, it'll be able to let us know which neighborhoods need these test kits. Then Amazon can deliver them to the appropriate housing, to the appropriate homes, so that people stay at home. Because we don't want people moving around, especially if they have all the symptoms. We don't even want them to go to the hospital. We want them just to stay at home. There's other delivery services with Lyft and with Uber, for example. I've already read an article that they're already trying to figure out ways of improving their delivery processes. Obviously, the Postal Service. So the test kit delivery team is crucial to figure out how to get tests to people so that they can update the app. Once they get tested and it's found out that their cough or whatever symptoms they have aren't actually COVID-19 symptoms, then they can report that and they can update the information on the database. Okay, so we're going to need a lot of help from infrastructure that already exists for developing this delivery system. And the nice thing is this structure already exists. It's already there. We just need to get the manufacturers linked up with the delivery system. And we need to have a means of communicating who needs the test kit so that it doesn't get abused. Alright, next we've got the sanitation team. I think this is a very important sanitation team component. Basically, the sanitation team is going to create a protocol to sterilize and eliminate the virus from spreading through deliveries. So how do we sterilize delivery trucks, packaging, things like that, so that when we do deliver these things, we don't spread the virus to the delivery people and also to who they're delivering. And this protocol can be used for other parts of other industries as well. So the question is, who can help with this? I'm thinking we need virologists, we need doctors. I don't know, people that know how to handle sterilization techniques. There was a YouTube video recently that my sister sent me, which was how to sterilize your groceries. It was very detailed, 20 minutes long, about how to take each bag, wipe it off, all these things. So these sorts of things are already popping up. So the sanitation team they will help develop this protocol so that everyone can execute it and not spread the virus through the deliveries themselves. Okay, so then the next team is the hospital response team. So our healthcare industry is totally overwhelmed by this problem. Our system of insurance, our system of financing healthcare, all of it is totally just against it's just inhuman, basically. But we're discovering that right now, I think. And they're overwhelmed. So how is this data going to help hospital response team? Basically, we're going to forward the data to the hospitals, to the healthcare workers, so that they have lead time. Lead time is very important because if they have 5, 10, 15 days lead time as these symptoms first emerge, they can move their resources around to best manage resource and staffing at their hospitals. Okay. We also want to we want to make people avoid going to the hospital. Avoid going if possible, because hospitals are they're the epicenters of disease. Avoid going to hospitals because they are the epicenter
Just to clarify, it sounds like
of disease.
with the symptomology report, they could also avoid going if they don't have the majority of symptoms.
Exactly. Yes. Right. So that the people will be. It'd be very clear what symptoms count, what don't count, so that way they don't even have to call and bother hospitals, right? And you don't want to show up if you're not if you don't you're very sure that you're sick, because you might catch it. If you show up and you're not sick and you show up where there's a lot of illness, you might even catch it. So makes it worse. So we want to make sure that people that go to hospitals are people that need that the life-saving treatment from a hospital. And so the lead time will help hospitals manage resource and staffing, and also the symptomology report will help deter people from going if they don't need to go. And ideally, we would create a response team that would actually go to people's homes, potentially, so that way the hospitals aren't overwhelmed by things. And that's something that this hospital response team can organize with local communities, potentially. So I'm going to say at home care, because there are very limited hospital beds. Can be organized. Let's say at home care can be organized. Okay. Next we've got my favorite team.
Oh yes, another question.
Yes, what's your question?
There is another possibility I know they are doing in Europe. It's like drive-in test. So people come,
Yeah.
they do the test and they just go off.
Got it. Yes, a drive-in test procedure. Yes. So the test delivery kit team could create centers for people to drive through instead of them. Yeah, that could work. That's another idea for sure. Okay, so now for my favorite team. This is Everyone Else. Okay, so stay at home as much as possible. Follow the local safety guidelines of your communities. Every community's got slightly different safety guidelines, but for the most part, I think they're pretty good. Once the app is up and running, report your symptoms so that the response teams can know what to do. I want to say maybe daily. And what we're going to do is we're going to put together a crowdfunding platform to help fund all this response effort. So go to covidviral.solutions to donate to the response fund. Okay? And everyone else can also think about maybe they have a skill set, maybe they know somebody that can help further this project, because basically we're just all in this together, right? Another idea too is how can millennials help the older generation work the app? Report their symptoms. Okay, so I'm almost over with this, and I want to take a moment to put everything together in one visualization. So let's put it all together. Putting it all together. Okay. Alright, so I have this really nice diagram. Here we've got the population. Here's all of us, all our stick people, family, friends, co-workers, friends and enemies. All of them are here in this population. Some of them are getting sick, some of them aren't. They're going to report their symptoms in real time to the data and visualization team. They're going to figure out how to best use that data. Okay, so here's the map, and here's all the hot spots of where the virus is and whatever, right? So here's the data and visualization team. We'll just call them the data team. Okay. The data team is then going to notify the healthcare team. Okay. So we can have a hospital response that can be better prepared. And then the hospital is going to be able to go back to the population to consolidate effort, consolidate resources, and focus effort. Okay? So as the hospitals do their thing, less people in the population are sick, right? They're taken care of. The symptoms then are reported, there's less symptoms, then the data team will update it, right? Things will get better. Alright? And also, from here we have the test kit delivery, the test kit delivery system. Oh, hold on. Okay. So here we have the system to deliver test kits to homes. Looking at Amazon here, looking at Uber to really step up to help take those test kits from the manufacturers, deliver them to the right homes. That the app or the data team says that, okay, this is an area that has a high amount of symptoms, so test kits will be deployed to those areas. And then, so the delivery team is involved with that. And then of course that then allows people to know, so symptomology data can be updated with verification of virus presence. Okay, so basically first report symptoms. Okay, symptoms, you can have them, but you might not have the disease, right? So the test kit then gets delivered. The people with the symptoms then get tested. The ones that have symptoms that don't have the disease then can notify the data team that they can be ignored basically by the hospital response team because they have been cleared of no symptoms. I mean, they've been cleared of no disease. Then the response team can be better focused. Okay, so this is how I put it all together, all the moving pieces and parts. It's a feedback loop, and this is the way that we can really understand what's present. This is the data that lets us know how to take action in an organized way. And then over time, everything will be that once the virus is eliminated, then we know that we can rest and we can go home. Or, I mean, we've been home this whole time, so we can rest. Okay, so that's the plan. And just to summarize, the take-home message here for everybody is, or I'm gonna say key actions that we need to take to move forward. Okay. So my question is, will companies like Amazon and Google step up? Okay, will they look past their company affiliation and their requirement for profit and help us use their infrastructure and resources to work together to solve this problem? Amazon's got the delivery and distribution infrastructure. Google's got the cloud, the data storage, and the people that would have the expertise to really help execute this concept. And then, what about everyone else? So we need people to donate to the fund. We need people with skills and extra time to volunteer. Okay. So when you get this video, this is a chance for all of us to take action, right? And I'm going to leave here the website to go to. The website to go to is www.covidviralsolutions. www.covidviral.solutions. And basically, we want to spread this video and this content. So we want to make the content go viral. Make this message go viral. So that it reaches as much people as possible, and we can have funding and support across the country. It has to go viral in order to fight the virus. Isn't that great? I mean, it's a bad joke. Okay, so that's my presentation. I wanted to end by just, I have one last thing to say. I want to dedicate dedicate this work to the love of my life, who believes in me when I don't believe in myself, and they know who they are, but I'm not going to call them out. And with that, thank you. Do you guys have anything to say to our viewers?
Well, thank you for watching.
Thank you very much for your ideas
Yes.
and enthusiasm.
Thank you
I
guys.
love it.
Thanks Miguel for the camera. All right guys, let's fight this thing. Let's beat this thing.